Welcome back. This is Dr. Travis Gratton with the University Veterinary Care Center. Thank you for joining us on this little series on wound management using fish skin and some regenerative medicine techniques. We do want to warn you that there are some fairly graphic pictures coming up in this video, so if you have a faint stomach, you probably don't want to watch much more beyond this point. So this is Searcy. She's a very sweet little Shiba Inu who was attacked by another dog. She had multiple bite wounds, mostly in the groin area on one of her legs, and she ended up losing a very large amount of skin. She was seen at the emergency clinic where they managed the wound. They got it cleaned up. They got her on antibiotics and pain medications, and then we saw her a couple of days later, and this is what it looked like. Even just looking up under the leg, we could tell that it was starting to die off and that the repair wasn't holding together anymore. A couple of days later, this is what the wound looked like. Because of the compromise to the blood supply, a large area had started to die off. The original big gaping wound in the groin was there, but then we also had this section down the leg past the knee. While we were developing our treatment plan and sourcing all of the materials that we were going to need to try to repair this, we just kept debriding tissue out of it and tacking down the loose edges of the skin in order to manage it as an open wound for the time being. This is Searcy on the morning of surgery. You can see she doesn't look like she's feeling too bad. We had gotten the fish skin in and the Platelet Rich Fibrin kits, and we were all ready to go. We had the wound pretty well clear of infection and dead tissue. It was relatively healthy granulation bed. After our final cleaning and prep, getting ready for surgery, this is what our wound looked like. Something I'd like you to kind of note is that these really thickened edges here to this wound, the body is trying to heal this. The cells are migrating in through the skin, but they get to this edge and then they just have no place to go. They kind of start piling up. So this is kind of where the fish skin comes into play in this, and it's going to give these cells some place to migrate across. So this is what the fish skin looks like. They come in little squares. All the cells have been lysed out of it, been flushed and washed, and the scales obviously have been removed, but you can still see the scale pattern. We're rehydrating it just in a little bit of sterile saline here, getting ready to apply the first piece to the wound. We're basically just going to lay this on top of that pink granulation bed, and then we're going to suture it down to the surrounding edges. Unfortunately, the wound bed itself doesn't really hold sutures real well, but we kind of tack it in as best we can, and then we're going to place some wraps over it in order to kind of keep it pressed against the wound bed, and this is going to start to incorporate down into that bed of granulation tissue, and the collagen is going to become part of the wound itself. And while we were in surgery working with the fish skin, one of our technicians, Alicia, had been preparing the Platelet Rich Fibrin. Basically, it's a product that's developed or derived from Searcy's own blood, where we collect the blood. It's treated a few ways. It's centrifuged down, and then we end up with these clots that we're able to take out. The clots contain some white blood cells, which will help with the residual infection on the surface of the wound, but more importantly, it contains all the platelets out of the blood, and the platelets are very, very rich in growth factors, which are going to encourage new cells to grow into this area and start to populate the new wound bed that we're creating with the fish skin. So it's basically cut off from the red blood cell portion, and then we use this little device that will compress the kind of the round clot into a thin little layer. It's called a membrane. It's actually somewhat tough, and we could suture it across a wound itself. What we chose to do with this one was actually just take these little membranes that she's going to pull out here, and we laid one of these under each one of the major pieces of the fish skin. So it's just this thin little piece that we can lay across the surface of the wound, put the fish skin directly over it, and then we suture the fish skin down. So here we're finishing up the last few pieces of the fish skin. It's kind of like a jigsaw puzzle. We cut them to fit, and then we just suture them across the wound. And this is what it looked like when we were done. We left a gap right along the groin there on the right end of this wound, because we knew that the leg was going to be moving in one direction and the abdomen skin was going to be moving in the other, and be very, very difficult to keep it in contact there. So afterwards, we put a wrap across all of this, a rather difficult place to keep it in contact, but we tacked it in there. The next day, this is what the fish skin looked like. It was beginning to incorporate down into the wound, almost kind of dissolving in. You can actually see by 3 days that it is completely gone. You can still make out a little bit of the fish scale pattern on the surface of it, but it's nice, pink, healthy looking tissue. And at this point, it's just a matter of waiting. We left the wound open. The owners were doing some hydrotherapy, just running water across the surface of the wound a couple of times a day to kind of keep a little bit of exudate, which consistently declined over the next few days. And about 10 days later, this is what the wound looked like. You can still see a little bit of the fish scale pattern in the wound bed, actually, but if you look real closely at the edges of the wound here, they're actually nice and thin. They're starting to taper down onto the wound bed. There's actually areas where you can see the little bit of the new skin that's growing across, and this wound is about 25% smaller than it was on the day of surgery. So here's a couple of before and after photos, which are at about the same spacing on the leg, and so you can see this is a pretty dramatic difference just in 11 days. We're excited to see what happens with this as time goes by, and we'll keep you up to date on this. Thank you so much.